Hello, I'm Dr. Pamela Ruegg. I hold the David J. Ellis Chair in Large Animal Clinical Sciences and Antimicrobial Resistance at Michigan State University. And today, as part of our series on severe clinical mastitis, I'm going to be discussing some important risk factors that are associated with development of this presentation. Now, mastitis is generally caused when bacteria infect the udder. In severe cases are often caused by environmental bacteria such as E. coli. Clinical mastitis is a frequent disease of dairy cows, but fortunately, severe cases occur very infrequently. Research studies have shown that the average amount of severe clinical mastitis is about 4 cases per 100 cows per year. Now, the severity of a case of mastitis is mostly related in differences in the ability of the immune response of the cow. It's more important, therefore, about how the cow can respond to the infection rather than differences among bacterial strains. Now, to understand why this is, we have to briefly review how mastitis occurs. Mastitis occurs when bacteria get through the teat canal and manage to establish an infection within the udder. So they get in through the udder, and once they get in through the teat, they start multiplying, and multiplying. And there is essentially a race between the bacteria multiplying in the udder and the activation of the immune system of the cow. The faster the immune system is activated, in other words, the faster that the immune system recognizes an infection has occurred, the more likely it is to start killing bacteria. And when they start killing bacteria, there's actually fewer of them there when they die. And this matters a lot because when the immune response is slow, then there's more bacterial colonies present in the udder. And when they start dying as a result of the immune response, more of their virulence characteristics are released, which can result in a sicker cow. This is most evident for E. coli mastitis because E. coli are a gram-negative mastitis pathogen, and they contain endotoxin, also called lipopolysaccharide, in their cell walls. And that means if the bacteria have had a longer period to multiply and there's more of them there, there's a larger dose of this endotoxin which is released, which will result in a sicker cow. So essentially, cows that have a faster and more effective immune response are more likely to have non-severe mastitis, even when infected with coliform bacteria. That means that the risk factors that contribute to the development of more severe cases of clinical mastitis are essentially risk factors related to the effectiveness of mounting an immune response. And there's some very practical characteristics of cows that we can look in to get a clue as to her susceptibility to becoming a more severe case. Older cows, cows that are in early lactation, cows that are in negative energy balance, cows that have other diseases such as ketosis or metritis, cows that are experiencing heat stress, and cows that have been treated with immunosuppressive drugs like corticosteroids, those cows are going to be less effective and have a slower immune response. Therefore, they're more likely to result in severe cases. Therefore, the way that we reduce the incidence of severe clinical mastitis is essentially based on ensuring that these high-risk cows are really well managed. And that means that when we're looking at these early lactation, older cows, we want to make sure we provide them with the best possible diets to minimize negative energy balance. In periods when it's warm, we want to make sure we're mitigating heat stress. We want to make sure we minimize the occurrence of other diseases, and we want to make sure that we reduce exposure to the number of bacteria that can cause severe mastitis by providing a clean and dry environment. So let's just recap these risk factors. To minimize the incidence of severe cases of mastitis, we need to reduce exposure of susceptible cows to bacteria, and we need to provide management that maximizes her ability to mount an effective immune response.